Assalamu alaikum. Dr. Arshad Mahmood here. In this video, we are going to learn some conditions that are associated with ear and nose area, and these are mostly congenital in origin. So, one is the preauricular area abnormalities. These are preauricular tags, fissure, sinuses, and eventually formation of cysts. And I will also discuss some conditions that are associated with the pharyngeal pouches that are the abnormal pharyngeal sinuses and their abscess, and also will discuss briefly of laryngocele in this video. So first is that preauricular tags. These are basically epithelial mounds and pedunculated skin tissue that are seen in front of the ear, mostly in front of the tragus. So they usually are cosmetic issues, and the important thing is that these are associated with other abnormalities, mainly involving the genitourinary tract, and also some time associated with the cardiological congenital heart diseases. So we have to look for those. This picture is also showing a preauricular tag in this photo. Again, a picture of preauricular tag is shown here. It is just in front of the tragus, and it is a mound of epithelial tissue is seen. Now is the preauricular pit. It is a small hole, a cyst that is just in front of your ear, above your ear canal. So it is in front of ear, and it is a gap is seen is here. The hole marks a sinus tract under the skin that is in the wrong place. These tracts are vary in size, and some people have a short tract while other have a longer one with lot of branches. So these are actually the hole. These are called pits, and that can lead to sinus and also to the cyst. So these are also a congenital type of lesions. This picture is also showing a preauricular pit that is leading to preauricular sinus, and patient can have at the end of a preauricular cyst. So these are congenital malformations. Now if these areas are get inflamed, infections occur in these area, then these can lead to formation of cellulitis. If only skin is involved, if there is formation of abscess, then patient can have the abscess of preauricular area in that region. So how you are going to manage these infections involving the preauricular cyst, pits, and fissures? These are managed by the antibiotic as well as by surgery. In antibiotic, we give the gram-positive cover in the form of first generation cephalosporin that includes cephalexin, or in the form of amoxicillin and clavulanic acid. And surgery is done in the form of incision drainage to relieve the abscess. This picture is showing a preauricular pit. The pit is seen in the upper part of hill near the pinna. Again, this picture is showing a cystic lesion in front of the ear, that is preauricular cyst with mild inflammation is also seen, so patient can have abscess at that area. This is typical picture of preauricular cyst with supervised infection and abscess formation. Now we will discuss some neck masses due to the branchial cleft cyst. This picture is showing some anatomy of and embryological structures in the form of pharyngeal pouches, grooves, and arches. So there are actually there are 4 pharyngeal grooves and 5 pharyngeal arches. These grooves are all located on outer side, and these usually disappear except for the first pharyngeal groove, which leads to the formation of external auditory meatus. All other are gets obliterated. So if there is if these grooves persist, then these can lead to formation of fissure, sinuses, and then cysts. So most commonly the second pharyngeal groove is important in this formation of cysts, sinuses, and fissures. This is again a picture showing the different locations of the remnants of these pharyngeal grooves and the sites where these can lead to formation of the sinus, fissure, abscess, and cyst. This is a picture showing some collection and erythematous skin in the area of the first pharyngeal groove. So these are the first pharyngeal groove infection in the form of cyst and abscess formation. Again a picture showing the first pharyngeal groove, abscess, and cyst formation. This child is showing again a large swelling that is globular in nature and seen on the in front of, and also involving the sternocleidomastoid muscle. So this is branchial cyst. Important thing about the branchial cyst, fissure, and fistula is that they are usually interior to the sternocleidomastoid muscles. This picture is showing a graphical representation of laryngocele, that is cystic saccular outpouching of the larynx. This is usually less common in infants and children. It is usually seen in the adult age group. And again, a picture is typically shown the saccular area on the neck of the adult patient. And these are usually these are expansile in nature, and they increase in size while the if you increase the pressure in that area as the patient is performing the maneuver in the form of pinching the nose. These are some conditions that I wanted to describe with you. Thank you for the listening.